everyone, I am VARDENAFIL. In today's video, I will share to you my autobiography. In the Philippines, you can call me Livatra or Staxin, and my chemical name is... My drug classification for therapeutic, I am an erectile dysfunction agent, and my pharmacologic action is to inhibit phosphodiesterase type 5. My pregnancy category is B, since there is no studies that I was used in women, nor in unborn babies in animals. I am an oral type drugs that aids with the erectile dysfunction of a man. I am a selective inhibitor of cyclic guanosine monophosphate, specifically phosphodiesterase type. So during sexual stimulation, nitric oxide activates the enzyme guanylate cyclase, resulting in increased synthesis of cyclic guanosine monophosphate in the smooth muscle relaxation, resulting in increased blood flow in the penis, resulting in erection. I am rapidly absorbed from the gastrointestinal tract, specifically in the mouth. However, high-fat meal can decrease my absorption, and my time to peak plasma concentration is about 30 minutes to 2 hours. I was widely distributed in the tissues. I was generally metabolized at the liver via hepatic enzyme CYP3A4 with a contribution of CYP3A5 and CYP2C isoforms via desethylation active metabolite. And I was excreted via feces for about 91 to 95%, and in the urine for about 2 to 6%. And my half-life is about 4 to 6 hours. For further discussion, I will introduce you my partner, another VARDENAFIL.
Hi there, I am also VARDENAFIL, and now I will continue discussing about myself. So you already know about my drug name, drug classification, pharmacodynamics, and pharmacokinetics. Now I will discuss to you my indications, contraindications, and my side effects. To all the boys out there who is suffering from erectile dysfunction, I am the answer to your problem because I am used to treat erectile dysfunction, and that is my indication. However, I am contraindicated to some people, and you can use me whenever you want to, because I have my own limitations and cautions that you should know about me. First, I am contraindicated to a person who has hypersensitivity to any component of me and a person who has an allergy to me. Second, make sure that you will not combine me with other treatments because it is not recommended. Next, if you are currently on a nitrate therapy, you should not use me because I may potentiate or increase the hypotensive effects of organic nitrates and nitrates, which is not good for your health. I am contraindicated in the presence of any anatomical obstructions or conditions that might predispose to priapism because the risk could exacerbated by me. Fifth, if you have severe hepatic disease or renal impairment and requiring dialysis, and especially if you have liver disease, you should not use me because as mentioned earlier, I am metabolized in the liver. Sixth, if you have device inside your penis or you have penile implants, please don't use me because that device is already enough, right? And if not, why use that, not me? Be contented. And especially if you have penile deformity, don't use me because it would be painful for you. I am also contraindicated to a person who has chronic heart failure, or in other words, heart problem, and stomach ulcer and bleeding due to vomiting disorder. Last, if you are experiencing sudden vision loss or hearing loss, and if you have leukemia, don't use me as your treatment. Now let's move on to my side effects. I have so many adverse effects on the different body system, such as reproductive system, endocrine system, circulatory system, cardiovascular system, integumentary system, gastrointestinal system, renal system, nervous system, eyes and ears, respiratory system, and immune system. In reproductive system, the side effect is that your penis will erect. In integumentary system, you will feel flushing and experience rush, and it will increase the risk of melanoma. While in circulatory system, it will increase the blood flow in your penis. In cardiovascular system, the side effects is that you will experience fast heartbeat and chest pain, and your heartbeat will not feel normal. In respiratory system, you will experience difficulty in breathing, runny nose and stuffy nose, and cough. While in gastrointestinal system, you will experience upset stomach, vomiting, dyspepsia, and diarrhea. In renal system, the side effect is UTI or urinary tract infection. In nervous system, you will experience dizziness, headache, and nervousness. You will also experience blurred vision or loss of vision, ringing in the ears, loss of hearing, puffiness, and swelling of the eyelids or around the eyes. And last is immune system, and its side effects is that you will feel tired or weak. That would be all. I hope you learned a lot of things about our biography, and please don't forget those. And here's a little reminder, if symptoms persist, consult your doctor. Thank you. Oh wait! Hi there! I am Suyom and I am a student nurse. So I'm here to discuss the nursing responsibilities upon administering the VARDENAFIL. Before administering VARDENAFIL to your client, you must assess first the baseline status of your client to determine any potential adverse effects. Assess the history of allergy, penile structural abnormalities, penile implants, bleeding disorders, peptic ulcer, heart problems, renal disorder, or hepatic disease, hypotension, if he has hypertension, and also assess the cause of dysfunction before beginning the therapy. Assess blood pressure, pulse rate, respiratory rate, and adventitious sound to evaluate the blood flow and potential changes in cardiovascular function. Assess the skin and lesions to monitor the adverse reaction to drug and cardiovascular perfusions. Evaluate the laboratory test for bleeding time and liver function to monitor the potential adverse effects on the liver. So now, during the therapy, monitor the patients with vascular disease for any sign of exacerbation so that the therapy will be discontinued before severe adverse effects occur. Monitor patients for use of nitrate or alpha blockers to avoid potentially cardiovascular drug-drug interaction. Provide a thorough patient teaching, measures to avoid adverse effects, warning signs of problems, and need for regular evaluation. After administering the VARDENAFIL, monitor the patient's response to the drug and for adverse effects. Also evaluate the effectiveness of the teaching plan. And lastly, monitor the effectiveness of comfort measures and compliance with the regimen. So those are the nursing responsibilities that you should not forget upon administering the VARDENAFIL to your patients or clients. Because as a nurse, it is your responsibility. Thank you, and I hope you learned a lot of things.